live on YouTube. And good morning to those who are joining. Dr. Randall Gates, board-certified chiropractic neurologist, also chiropractic physician at Gates Way to Health. Today we're talking about rheumatoid arthritis. It's an update video. We're joined by Kathy. Good morning, Kathy.
Good morning, everyone.
And we're talking about RA just to see if there's any new information. It's probably not a bad idea to recap some of the stuff that we talked about. I think it was around December of 2018 was when we were talking about rheumatoid arthritis last. We've been doing our sequence on autoimmune diseases, so this certainly fits right in because it's one of the most common and widely recognized autoimmune conditions out there. Autoimmune, again, refers to when our immune system attacks our own body, which should not happen. You have lots of checks and balances within your immune system to make sure that that never happens. But it seems that this autoimmune issue is becoming an epidemic, and we are all learning of more and more people that we know and love who have autoimmune problems. So, good morning. I love the comment that somebody just posted about them watching and enjoying their breakfast. So anyways, Kathy, what did you have to say about RA before we get too far into it?
Well, I think it's extremely important because all of us have someone in our life that is affected with this. Mm-hmm. And I think if you could go over just a really good review of how rheumatoid arthritis is actually a bacterial disease that most general medicine does not speak about, that would be a really good place to start.
Okay. So going with that, rheumatoid arthritis, as most doctors are going to learn about, you're going to learn about it from a diagnostic presentation standpoint. How does someone come in and all of a sudden they have horrible joint pains and they may be fatigued and they may have redness around their joints. And so the doctor starts running x-rays and blood tests to further chase down the cause. And rheumatoid arthritis at this point has some characteristic blood test findings associated with it. In the medical model, they're going to usually prescribe meds, which used to be referred to as the DMARDs, disease-modifying anti-rheumatic drugs specific for rheumatoid arthritis. But now, within that class and beyond are the biologics that Kathy and I have been talking about. The biologics are drugs like Humira and Enbrel, drugs like that are Xeljanz that are going to target immune cells and get rid of them. That's the standard model out there. Whereas what Kathy is alluding to is in the functional model, we want to say, well, why does somebody have rheumatoid arthritis? It's not just a genetic condition. There's a genetic association or predisposition for it, but it doesn't mean that it's a genetic condition. So what is causing someone to have RA? And the current literature is coming out that it is heavily associated with bacterial translocations from the mouth or your gut to the joints or to other areas of the body. And so these bacteria we're finding seem to get out of the mouth into what's referred to as the crevicular fluid, so periodontal infections, things like that, and then they get into our bloodstream, and whether they're alive or dead, they seem to evoke this specific immune response for RA. Now, to me, that's a huge deal because now we have something in terms of cause, because we're always looking for cause. Unfortunately, within medicine, as Kathy and I have been talking about lots of times, it's a Band-Aid approach. So does that kind of answer it, Kathy? I mean, I'm going to go deeper into it, but from a general perspective.
Yeah. Let's dig in there because there's a lot of stuff involved in this. And, and like I said, we don't want to put a Band-Aid on it. We want to get to the root cause and figure it out, what is bringing it on, and then we can work to alleviate it. And I don't like the fact that when I look up stuff on the internet that it says chronic can't be cured, and I'm not saying we can cure it, but we can definitely lessen a lot of the symptoms and give people a lot more relief more naturally than dealing with all these I won't say narcotics, but the different drugs that they have to take that are so damaging.
Right. So I would say on that standpoint, basically research is coming out. So I mentioned Prevotella. So let's take it at three elements, three different perspectives. Going back in time, there's a guy, and I always mess up his name. I think is Ebringer or something to that effect. He's a rheumatologist out of the UK. And he started finding associations with this urinary bacteria called Proteus mirabilis, where he was finding in RA patients that he could culture this urinary bacteria. And he found that this urinary bacteria cause the specific immune reaction or antibody reaction seen in RA patients. And so he published it. And then he went on to talk to other rheumatologists around the world. They basically did the same experiment, and he validated that this Proteus mirabilis infection was present on 6 different continents. So basically, he showed this is an issue for RA patients. He took it a step farther, and he sequenced this bacteria. So like in terms of the bacterial DNA, and he found that the amino acid structure, which is basically one step down from the DNA, the amino acid structure of this bacteria is very similar to dietary proteins that we're eating. Kind of interesting. So then he takes another step further and he starts putting people on certain diets, and he's finding that after something like 15 to 18 months, he was getting huge improvements in their rheumatoid arthritis. So that was a big deal. Now, of course, as Kathy and I have talked about, it's a reality of the world we live in. Is somebody going to make $1 trillion on a diet for rheumatoid arthritis? Probably not. But the biologic market is $1 trillion market. Sure. So that's just one little piece of information for those of you who are looking for natural solutions. Going a step farther, researchers also started looking into Prevotella species. Prevotella is a bacteria in all of our intestines. It's quote unquote ubiquitous, but they were finding that in RA patients, this Prevotella was overgrowing, and that has been substantiated. And they're even seeing that in the preclinical stages of RA, these individuals have way more Prevotella in their gut than other people do. And it has been also found that Prevotella bacteria are in the joints of RA patients. And then we also talked about the Porphyromonas gingivalis. There's also another one, Prevotella intermedia, that also come from the mouth into the bloodstream. And it's very interesting. I was talking to a dentist yesterday about this issue, and he said, well, what do you do? And I said, well, really, you got to encourage basically dental health for RA patients, which no one's talking about. And I think Kathy and I were mentioning it before we came on, read about RA on the Mayo Clinic website. They're not talking about dental health. But if you know somebody with RA, you probably should say, hey, how healthy are your gums? That's definitely something I would be looking into first and foremost. I would also say, hey, have you had any bacterial testing on your feces, basically? Have you had any fecal testing? Because that may be important just from a general perspective for someone to say, hey, I have RA, do I maybe have an overgrowth of Prevotella? So going a little further, and miss you too to all the people that are saying hi on Facebook. So going a little further, the specific immune reaction, or let's say it this way, the way rheumatoid arthritis is diagnosed is through the CCP antibodies. It stands for citrullination. So the CCP antibody is characteristic of RA patients. Now, it's not 100% in terms of sensitivity and specificity, but it's pretty dang high. So many of you have like a RA factor run if you think you have rheumatoid arthritis, and certainly RA factors can be high and are high in rheumatoid arthritis. But just because you have a high RA factor doesn't mean you have RA, if that makes sense. So the CCP antibody has kind of replaced that. Well, we're finding that these 3 bacteria that I mentioned cause CCP antibodies. So basically, these bacteria activate this enzyme called peptidylarginine deaminase, and that facilitates these CCP antibodies. So it is very much a smoking gun, so to speak. And it's just like how I was so excited about the stuff on lupus that came out last summer, because now they're saying that lupus is due to a gut bacteria, Enterococcus gallinarum, coming through the intestines into the liver, and that specifically causes lupus. And that was in the top scientific publication in the world. So,
and that's extremely large. I mean, that's big, people.
Yeah, that's huge.
Because people have dealt with lupus for a long time. They either deal with it their whole life, or some succumb to it, go ahead and die. Very, very serious thing. And if we think, okay, if there's just a bacteria, this new information doesn't usually show up in your normal medical model like it does for the alternative and the functional guys that are looking for causes. What is wrong with this person? What needs to be corrected in their balance? What needs to put them back at level position? That's right. What Dr. Gates is doing, which is so amazing.
Yeah, it's definitely a different approach, and it's a harder approach for all of our patients out there. We know that it takes a lot of work, it takes a lot of dedication, but we've seen some pretty interesting changes in RA patients, I will say, through time. So now going a little farther, and this is what we highlighted on in December, but I'll go through it again. So the new interesting frontier, so to speak, in this RA world of bacteria from the mouth and the gut and the urinary tract is being able to chase down exactly which one it is that's causing that individual's problem. And these are referred to as Finespecificities. So these Finespecificities, basically, we can take the CCP antibodies and we can segment them down even a little bit farther and say, okay, well, your rheumatoid arthritis is due to porphyromonas gingivalis, or your rheumatoid arthritis is not due to porphyromonas gingivalis, it's due to smoking, because smoking is a risk factor for RA. Or no, your rheumatoid arthritis is due to Prevotella. So now we're going to get more certainty and more clarity so people can have, a better treatment specific for them, because maybe your rheumatoid arthritis is totally a mouth issue and not a gut issue. I would argue that they're kind of one and the same, but that's a really cool frontier as well that RA patients will have access to, so they can broach these functional treatments with more clarity. So going farther, I even read an article, Kathy, about a supplement, I'm not going to mention its name, that we use frequently in our practice that is being shown to help RA. It's a supplement for the gut. So that's pretty cool, showing a lot of promise and different types of models. So yeah, I mean, you have had a lot of friends and acquaintances, correct, Kathy, with RA, and you've seen
and I just
what it does
talked
to
to one
people.
yesterday who's gone ahead and following up with the dental work that she needs, because you and I discussed this, and of course I share it with my friends when we go through this of what you see. And I think the question kind of came up. We have smoking, we have the bacteria in the gut. Okay, this friend of mine does smoke, or I think she's trying to quit, but has smoked her whole life. And then she was told she had, she's got this gum disease. It's pretty rampant, actually. So she's trying to address that, get that taken care of, which, of course, is not an inexpensive issue that she's dealing with.
True.
But at the same time, she's been on Enbrel and all these other expensive medicines that her insurance company, doesn't like to pay for. My question was, okay, we understand that the gut and the bacteria are related. What about the smoking as far as the deterioration of the mouth itself? Does that, do you think, bring on or ease that so that the bacteria can take hold?
I think that's definitely a plausible mechanism for sure. I think it's actually a great point. I think when they talk about smoking, usually they're talking about smoking having some effect on activating this whole peptidylarginine deaminase enzyme in the CCP process. But yeah, I mean, I would think that's, how could smoking not affect your periodontal tissue? I think that's a really, really good point. I like it. I like it.
I mean, it came to me a while ago when you were talking, and I thought, there has to be, when you said smoking gun, I thought, quick, there's part of it, okay, maybe that's bullet, I don't know. But the two are definitely related, and I've spoken before. My mom passed away, so I can talk about her all I want. And she smoked her entire life, and we talked about the fact that she had diabetes, which I think some of the research I did this morning talked about people being overweight and how that brought on more problems as far as the rheumatoid arthritis goes. There seemed to be an awful lot of things that were secondary that I'd never heard of before as I looked at this research this morning. I mean, all we ever heard about, my mom was dealing with this years ago. They did things like gold shots and all sorts of things to try to alleviate the pain and so forth. And I thought it was weird because, and I know there are people who go in remission and stuff, but it didn't seem like she ever did. But pain seemed to be a constant type of situation. But the stuff I read this morning talked about rheumatoid arthritis affecting your skin, your eyes, your lungs, heart, kidneys, salivary glands, nerve tissue, bone marrow, and blood vessels. So, I mean, this is a really, that's through your entire system, basically, not just your joints. And something that people, again, need to be aware of, that there's more damage and things that can go on here than just what meets the eyes or the feeling of the pain in your joint. Or, do people turn around and get knee replacements because they have rheumatoid arthritis?
Sometimes, yeah. Actually, yeah, they do. Mm-hmm.
Okay, because our normal thought is of the poor person that we'll see with their fingers all
right,
deformed,
right,
and think, oh gosh, that's got to be painful. That they can't tie their shoes, they can't open a jar of mayonnaise, they they can't do any of these things for themselves because of this deforming disease.
Mm-hmm.
But from what you're telling us, if we pay attention again, and I'm always beating this drum, it seems like that if we keep our own health journal, then all of a sudden we have these kind of symptoms. Then maybe we need to be looking and saying, okay, if I'm having this, what is causing it? Not what will stop the pain so much. Yes,
right.
We want the pain to go away,
right.
But we want to figure out why the pain's there in the first place. We weren't born with it. And, I read the stuff. It says, okay, if you're overweight, if you smoke, if you have a genetic disposition, it could be something in the environment that brings on this sort of stuff. But as you pointed out to us, there's a whole lot more to this story than just genetics or pollution or whatever. I said we need to be paying attention. If we want to be healthy and feel good and lead a very active life, then we need to be aware of these changes in ourselves so that we can address them.
I agree. And I think what you just hit on is the factor as to whether someone is going to be really successful coming out of our type of management or not. In essence, it really requires a lot of vigilance long term as to how you're feeling. Now, for the RA patient out there who's saying, okay, I understand this is a mouth bacterial issue, gut bacterial issue, urinary bacterial issue. Okay, what do I do with it? Well, I can't really tell you exactly what to do with it because everybody's different. But let's just say if you were to come see us, for example, I'm not being pushy, just use an example. And we take you through functional treatments and we augment the foods you're eating, not from the standpoint of changing your foods from a food allergy perspective, but how your foods interplay with your gut bacteria. And then you go through that and all of a sudden you start feeling really well. This is what Kathy is saying, and that now you need to be really aware of what you're eating over the long term and how that's affecting you. Or maybe you stop taking your supplements and how that's affecting you. Because these changes typically are not immediate, they're slow, and they protract. And we have such an immediate gratification society. I'm guilty of it too. We're all guilty of it. What do we got? We got our phones. Our phones are going off. We're looking at our phones all day long. You want something, you get it. Now we got these wonderful online retailers. You want a shirt, it's there next day. And so everything is now. And it's no wonder that the natural proclivity for all of us is, okay, you got RA, you're going to take a medication that's going to make you feel better now. And that's great. It has many, many advantages. But by the same token, if you're really looking to get to the underlying cause and you're trying not to just mask symptoms, it's a slow, arduous process. I'm not saying it takes forever, but it's low and slow. But slow and steady, as we were all taught very early in life, the story of the tortoise versus the hare. Who wins? The tortoise. So that's what we're pushing. That's what we recommend. Not pushing, but you know what I mean. That's what really that's our bend.
We're preaching for a reason, and that is the fact that there is an alternative to the Band-Aid. Just like my friend who uses Enbrel and so forth, that has to have the testing every so often to check different functions in her body, whether it be the lungs or the kidneys or whatever, to make sure she's not damaging them or how far the damage has progressed, because these drugs do that. My other friend who has RA suffers in pain all the time because she can't take those drugs because she's already damaged her kidneys. She's already got so much damage that she's like, okay, I'm cold turkey. I'm not taking these. I'll use topical creams or whatever I can use to try to deaden this. And again, as you said, it's not easy because I talked to her. We tried, working on the diet, taking some supplements. And most of us, like you said, we want the quick fix. So denying ourselves the foods we've always eaten, taking a few supplements, taking maybe that tortoise route is not easy. And maybe not for everyone, but I always think it because I've always dealt with my weight. Always, my family are not small people. We're big German bone people.
I know what you mean.
It's hard.
I am too.
Hard to stay thin. And I always think, just think of the diet industry, people. How often does a new diet pill come out? I cannot tell you over the years, because I am not a young person anymore, how many different diet pills, because we all want that magic pill that's going to work, whether it's for pain, weight loss, whatever the situation. That's what we really want. And people keep making them and telling us that they exist and that they will work. I've never seen one yet. I haven't. They make you nervous. They make you pee all the time. Lots of things, but they don't. And because you pee all the time, you lose 5 pounds, and that's all you lose. And you sit there thinking, why am I not losing any more weight? Well, because it said don't change your diet. Just do what you normally do, and you'll lose weight. And that, I'm sorry to say, does not work. Right. Change your diet, get more exercise. If you want to be a healthy person, that's kind of the route we have to take. And I always think, take a page from Dr. Gates' book, Who Wants to Live to Be a nice, ripe old age. And most of us do, but what do we all say? I don't want to live to be that old if I'm not in good health.
Right.
And especially people at my age in their 60s
right.
are all saying that, I don't want to live to be 90 because so-and-so was in a wheelchair and they were this and they were that and they couldn't get around and they didn't have quality of life. Okay, you don't have quality of life because, you're going to dialysis twice a week, or you've got diabetes so bad that, maybe you've lost a foot, maybe, some
right.
other thing has been calling you. This is the time to start thinking about, what's detrimental to me and what's going to make me a healthier, happier person. And what do most people say? Especially, again, as you tend to get older. Okay, if you don't have your health, you don't have anything. I hear it all the time. You hear it in movies, you hear it in books.
Right.
Everybody says that if you don't have your health, you don't have anything. And if you can't look for it or be responsible for it, I'm sorry to say, your general practitioner is not going to be. He's just going to find you that Band-Aid. He's going to find you that medicine that makes you feel good now or feel better, but he's not going to eliminate that problem.
And they have no time. I was talking to a GP yesterday, and it's like they try to tell people about diet, whatever diet they're kind of pushing. They have no time, and most people don't even care. Most people don't hear them, and it's a big problem. And then what is eating healthy? What I would say on that, because Kathy and I did some, I think they're pretty good radio shows. So if you go on our YouTube page, you can access them. All the stuff we talked about with autoimmune, we talked a lot about diet. They were like 45-minute long shows. So we put a lot of work into those, and we talk a lot about diet more specifically. So those of you who are wondering, hey, I have RA, what do I do? Maybe go back and listen to those and see if you get some ideas, because we talked about the literature as it pertains to changing the microbiome. But I agree with everything you're saying, Kathy. It's not easy, but we as a society have to be more proactive. You would love
to have a nice big double cheeseburger.
Yeah, of course.
And a milkshake.
Right.
You would love to, but you don't because you know how detrimental it is.
I was thinking about when I used to go to In-N-Out in college. It was 4 double doubles, I think 2 fries and a Coke. Yeah, tastes great. Didn't really make me healthy. I ended up having a lot of health stuff because of the way I was eating. For my rationalization with sports at that time. But it's just, I would love to eat a lot of different things, but at this point in time, feeling better, which sounds so cheesy, it does, because I've heard people say it to me when I wasn't healthy. But once you find the right food plan for you, and let's just say you can stick with it for 6 weeks, you're probably not going to change as much off of that diet, because you're going to know. And the successful patients, like I was saying before, are the vigilant patients that say, okay, I'm eating whatever. I'm eating these chocolate covered whatever, or I'm eating, pancakes that are paleo every night, and I'm not feeling as well as I used to. Well, that's where we have to pay attention. Kathy knows I was on an asparagus and broccoli binge, which sounds funny, but I was trying to eat healthier. All of a sudden I'm a wreck. Right. All of a sudden I'm a wreck, and I having all sorts of symptoms again. Well, those aren't good foods for me. They're seemingly healthy, but they're not good for me. So if you're out there and you're eating whole grains, you think you're healthy, well, maybe some of those whole grains aren't the best thing for you. So I think we're pushing.
That's the thing to really push the individuality of how your testing works and how you figure out what works for each individual, because that gut in everybody is different, and those people who can't withstand dairy, or the people who can't handle gluten, which should be almost everyone who can't handle that.
Right.
That's kind of my big enemy. I have this ongoing war with gluten, and when I'm stupid and I eat some of it, then I'm like, okay, gluten won today, but it won't win tomorrow. So those are just a few of the things that people need to look at. And if you have rheumatoid arthritis, I personally feel like, gluten's the first place to react. Is just get rid of all of it in your cabinet and get rid of it. Even if you don't have the money to see a doctor, if you don't have insurance, whatever the situation is, that's the first. Everybody I talk to, that's the first thing I tell them to do. I said, try it for 2 weeks, try it for a month, and see if you don't feel better. So that's my quick fix for anybody. But I think, again, it's just a matter of common sense. As if there's something that's bad out there for you, then you need to find out what it is and replace it with something that's going to make you feel better.
Yep, I like it. So we're at the 8 o'clock hour, so I got a boogie. But if anybody has any questions, if you have
let them know
topics,
you're not going dancing, you're going to see patients.
Yeah, so 8 a.m. here in Vegas. I got my ice pack here to cool me down before I started the broadcast because it is a little warm. So anyways, yeah, we'll be back next week. Let us know if there's anything you want us to talk about. We've done a lot of the autoimmune conditions, so we're thinking about our future direction. So this would be a great time for comments anytime throughout the week on Facebook. Let us know, and we'll go from there. All right. Thank you, Kathy.
Good morning, everybody. Have a good weekend.
Okay. Sounds good. Bye, everyone. Have a good weekend. Here, and we're going to end on